Okay, we are live.
Okay, it is now 6:31. I'd like to call to order the special meeting of the Common Council of November 30th, 2020. Ms. King, if you'll please read the announcement and call the roll.
This meeting is being recorded or rebroadcast. We ask everyone to speak clearly one at a time. Please state your name when called upon by the presiding chair. Members of the public can access this meeting by telephone, Zoom, and/or the City of Norwalk YouTube channel. Mr. Burnett,
Present.
Ms. Johnson, Mr. Langella, Mr.
Present.
Sachinelli,
Present.
Mr. Sachinelli,
Present.
Ms. Smith,
Here.
David Hewleman,
Present.
Mr. Roberts,
Present.
Ms. Revolos, Ms. Young,
Here.
Mr. Kides,
Here.
Mr. Theodorides,
Here.
Mr. Keegan,
Here.
Mr. Sirenides,
Here.
Mr. Livingston,
Here.
Ms. Shanahan,
I'm here, and I note that Ms. Johnson just joined the meeting.
Ms.
Thank you.
Johnson?
Here.
Hi, okay.
Lisa.
You have 15 present, you have a quorum.
Thank you. Mr. Sachinelli, we have the item number one, item 2A1. Is this going to be on consent or are we going to go into discussion?
I believe we're going into discussion on this item, Mr. Mayor.
Okay. So,
Could somebody share the agenda? It is completely frozen for me.
that's the only item on the agenda.
You want me to read the item?
Yes, would you please? Thank you.
2A1, authorize the mayor, Harry W. Rilling, to execute the CDC COVID-19 vaccination program provider agreement and any other necessary documents to participate in the program.
So, Mr.
Thank you.
Sachinelli, are you going to move that?
Yeah, I would like to move the item, please. I believe there were some questions of the council. Was there any questions or discussion at this time?
Okay, Mr. Livingston.
Yeah, I mean, can somebody explain what this is? Sounds good, but I don't know what it is.
Ms. Diamore? Ms. Diamore?
I'd be happy to, unless Darren, do you want to say anything before I start? Or?
Well, why don't you give a short explanation of why we have the agreement?
Sure. So this is a requirement in order to provide COVID-19 vaccination. So anybody who is providing it in Connecticut has to enroll in the Connecticut vaccine program and have this agreement. We're already enrolled in the vaccine program, but it's an agreement that's required from the CDC for anyone who's providing the vaccine to sign this agreement. And so we're anticipating that vaccine could be approved and authorized and be available as early as next month in December. And so in order for us to provide vaccination, we have to have this agreement in place. And just a little bit of a background. So we know there's going to be a phased-in approach for vaccination once we do have vaccines approved. And health departments, local health departments, are tasked with vaccinating the critical workforce. And so we're already preparing to vaccinate those who work in the police department, fire department, EMS providers, as well as collecting information on those who work in schools. And so we're working on that planning and we're getting ready and prepared to start vaccination. So that'll be the first phase to this. Healthcare providers and workers are also one of the populations we believe is going to be the priority, and that'll be handled, by a different sector. But local health departments are being tasked with vaccinating the critical workforce at the beginning phases of the vaccination.
Great,
So
thanks,
Darren,
Deanna.
what are we committing to do here?
Well, the CDC has come up with a series of requirements for distribution of the vaccine. So basically, it memorializes what those requirements are. In a nutshell, it requires the city to comply with, or the health department to comply with CDC protocol and guidelines as far as administering and distributing the vaccine. So it's the terms and conditions upon which we get distribute the vaccine to the general public.
Do we have any liability out of this?
There's,
Mr. Callahan?
I think there's probably always some liability in any agreement, but there's no indemnification obligation or anything of that nature. So it's certainly a potential to have liability based on compliance with the CDC guidelines.
Are we going to see any, the written language and documentation?
Yeah, I believe it was circulated to
Okay,
the council
I
as
don't
part
see
of
it.
I
the
didn't see
initial
it.
email.
I didn't see it.
I didn't either.
Darren, are you referencing what you sent me that I forwarded on to the council?
Yes, Councilman.
I saw
Okay.
it. I was able to read that.
I guess.
So it's an 8-page document, but the agreement terms are essentially set forth in 2 pages, and it redirects to CDC guidelines. It's very streamlined, I guess that's the word I would use. It clearly was intended to facilitate a quick turnaround.
Darren, if I may just add a little bit more detail to that. So there are certain standard requirements, right, when you give a vaccine. So they're called vaccine information sheets. You know, whenever we give a vaccine, we have to make sure we provide that information to those we're vaccinating. So there's a requirement in here that it's either, you know, a VIS sheet, or if the vaccine is approved under an emergency use authorization, which we're anticipating it may be, we have to give that specific fact sheet out when we immunize. We also have to be able to upload the information and provide data about any vaccine that we're administering within 24 hours. So there are certain requirements that are listed within the agreement that will be standard across the country for anyone who's providing the vaccine.
Mr. Livingston, do you have any further questions?
No, thank you, Mayor.
Mr. Burnett?
Yes, Darren, you covered liability, but is there a financial commitment on the part of the city by approving this agreement? And if there is, what is that amount? Or do we have any idea of what the amount is?
Yes, that's a great question, Councilman. There is no financial commitment on the city. The way the agreement's set up is really designed to ensure that we're following CDC guidelines as far as the administration of it, but there is no direct monetary commitment in the agreement.
So just to follow up with that, so any cost that we would be imposed upon us in terms of following those guidelines by us approving this agreement, we're willing to absorb those costs.
It's essentially the cost of being a provider of the vaccine.
Can I just add, you know, we got that recent funding, the epi and lab capacity, and part of that funding we wrote in the grant application was to provide additional nursing support for vaccination. So we are getting, you know, some funding to be able to provide some of these services. And we also have 50 of our emergency response team volunteers already signed up, willing, wanting to help us to support this effort. So we have a great volunteer effort to support as well.
Mr. Burnett, any further questions?
No, I mean, I'm supportive of this, obviously, because of the vaccine and the urgency of it. It is just somewhat kind of a open-ended approval that obviously this isn't going to be free to the city in order to administer. It would be helpful to understand what our financial commitment would be, so we're in the best position to administer it in the proper way. And it doesn't appear that we know what that number is or potentially know what that amount would be.
Mr. Callahan or Ms. Diemar?
I don't know if you could speak more to it from your side. As far as the cost of acquiring the vaccine, there is no cost associated with obtaining it from the CDC under this agreement. There's probably what you would call soft costs in the form of the employee resources and staffing resources you need to actually do the distribution end of it, and that would be something that Deanna could speak whether her department is currently staffed to handle. I know Deanna and I've worked together on some of the grant funding and additional volunteer agreements and staffing that need to be set up to establish, contact tracing and other COVID-related staffing resources necessary during this pandemic. So I believe that Deanna's department is well positioned, but I'll let her speak to that issue.
Yeah, thank you, Darren. So, I would just add, we're a health department that vaccinates. Not every health department across the state vaccinates, as much as we do. So we provide our, community flu clinics. We have, a travel and adult immunization clinic. We provide standard, we have childhood vaccination that we've done for years. And so, we have built this infrastructure over the years to provide this, this type of service. This is core public health. This is, what we do. And we're ready to step up and, provide this for our community. I do want to add that, there's not this expectation that the health department is going to vaccinate the entire population. There are going to be several different providers in Norwalk that are going to be providing vaccination. They're looking at, pharmacists and nurses and doctors throughout, the country that are going to be doing it. It's not just going to be health departments. So in terms of, our costs and our resources, they're really going to be directed towards that critical workforce within the city. And then after that, as the vaccine becomes more available, there's more production, really looking at those who have, who don't have as much access to healthcare services and don't have that ready access to vaccines as some might. So we're really going to be focused on specific populations to serve the community.
Any further questions, comments, discussion?
So what other population other than city employees do you think are going to be next in line? I know there's a lot of conversation about the minority community has been disproportionately affected by COVID. So what are your plans there?
For sure, Ms. Young. So we're the state and the federal government and the State Department are going to be providing that clear guidance to us. There are several national groups that are meeting about this right now to determine all of those priority groups. And so we're really going to be following, what the national and the state, public health officials are guiding us towards. But I know for sure that is, a group that they're looking at in terms of, vaccination.
Thank you.
Ms. Johnson, I believe you had your hand up.
Thank you, Mayor. Deanna, Darren, I don't know who to ask of this because it maybe is more appropriate for the chiefs, but I've read, as you probably all have, that FDNY is not requiring medics and firefighters to get vaccinated. Do we foresee any issues if that's the case here, where we have some first responders that just opt out? Is that going to put us at risk of being non-compliant with this agreement?
So in terms of the CDC agreement that's currently before the council, the answer is no, it won't put us at risk in being in non-compliance, and provided that there's not some shift in CDC guidelines that makes vaccination mandatory, in which case we'd opt out of the program.
Okay.
Or we'd have to make a decision on what to do there.
And to just follow up on Councilmember Burnett's point, I know that a lot of the vaccines need these specialized freezer units or, cooling units. I don't know what to call them because they're so cold that aren't readily available like a normal freezer. So is that part of what we're going to be getting, or is that an outlay we have to consider in the budget?
That's a great question. So we're anticipating we would be getting the Moderna vaccine, which doesn't have those strict requirements that the Pfizer one does in terms of the cold, the storage. So it's a little more flexible for us. So we're not anticipating needing to meet that requirement right now. There is additional funding available through the state if we do have requirements for equipment for vaccination.
Thank you.
Any further questions?
Do we have a number on what we're looking at as far as vaccinations are concerned? This round?
Yeah, so I mean, we've heard that we could be getting groups of 100 at a time doses. So we'd be scheduling, 100 at a time, but that number could go up. We're still waiting for the final numbers and the final guidance on all of this, but definitely in the hundreds and building as we move forward.
Mr. Keegan.
Yeah, hi, Deanna. When do we expect this all to start happening?
So we're thinking the approval could be given mid-December for the vaccines, and then states could start receiving it like in December, and not sure when exactly we would receive it, but we're looking at end of December, January.
Ms. Shanahan.
Yeah, so I understand that some of the vaccines are 2 doses. So does that complicate your life? And are there plans in place for finding people to come back in a certain amount of time, et cetera? Can you explain what the protocol is around that?
Sure. So we know there will be like 2 doses, and we know we're going to have to follow up to, and when we're getting the allocations, that's going to be in the consideration. So we'll be, once they commit and certain to us, they'll be committing, the 2 doses and making sure we're able to follow through with that. But in terms of vaccine series, I mentioned before how, we provide other vaccines. So this is certainly not the only one that has, multiple doses. And so we'll follow, similar protocols that we follow in order to, schedule, make reservations for the next, the second dose, and make sure we follow up and send reminders and make sure that people are able to complete their series.
Any further discussion or comments? Seeing none, I'll call the vote. Ms. King, would you call the roll?
Mr. Burnett,
Aye.
Ms. Johnson,
Aye.
Mr. Langella,
Aye.
Mr. Sacchinelli,
Aye.
Ms. Smith,
Yes.
Mr. Hubelman,
Aye.
Mr. Roberts,
Aye.
Ms. Young,
Yes.
Mr. Kides,
Yes.
Mr. Theodorides,
Yes.
Mr. Keegan,
Yes.
Mr. Sirenides,
Yes.
Mr. Livingston,
Yes.
Ms. Shanahan,
Yes. Yes.
14 yes. 14 yes.
Motion carries. Thank
It's
you.
unanimous.
One more motion.
Motion to adjourn.
Who was that, George? Mr. Sirenides?
It was me. I beat Lisa this time.
Yes.
I was up.
All in favor?
Raise your hand.
Opposed? Abstentions? Motion carries. Thank you all. Good night.
Have a good night.
Thank
Thank
you
you for meeting on such short notice, everyone.
Thank you.
Right.